It's a very challenging process because we're actually merging two very different systems. The private insurance system is a system based on risk, so it doesn't matter how much money you make, it just depends on what risk the insurance company assigns to you. And our social insurance, which is based on income, right? So you're merging two very different systems. If you look at the private insurance, when you get to your claiming age, let's say between 60s, 70s on up, your premium skyrockets, it goes through the roof. Under the general health insurance, actually, your premiums all decrease because your income decreases. So, you might see that the expenses are higher during your working years, but actually when you look at the lifetime costs, it's actually lower than what they're paying now.
Laws are never executed. It's only executed when there's a personal situation. I don't like you, or I have an issue with your family or friend. Then we see the law come to play. And the fear here is that the national health care plan is you're gonna have people flying into this island. Well, the droves.
So a couple things. Number one, what we're looking at is basically a waiting period before you could enter into the healthcare system. So in other words, for the first year, you would have to purchase private insurance, so that exactly to avoid that people fly in simply to take advantage of our health insurance system and our healthcare system. And the other point that you mentioned, what was I forget the earlier point. Oh, the mistrust in government. So again, I understand that. And in our conversation with stakeholders, I understood that very clearly. So for example, what we've done is we've built in the possibility to opt out of the system. You would pay a fee in order to opt out, so in order to maintain the solidarity principle, because we know that there's people in the community who can't afford to contribute a lot financially to the healthcare system, and there are those that can afford. So if you don't want to participate, we're building in the possibility that you don't trust the system, you pay what we call a solidarity fee, and then you would be able to opt out of the system. So we are trying to build those mechanisms in so that we can, over time, earn and gain the trust of the people.
We're not saying you're corrupt. Those are not my words. The words of the people is that the government of St. Martin is corrupt. There is no trust. And here the government is asking us to take a leap of faith to believe them again when they were wrong with 10-10-10. They were wrong with so many other things. And now you're saying, well, we're going to have this general health care plan and it's going to be good. Trust us, it's going to be good. I'm telling you. And Ms. Lee, probably 10 years ago, I'll be sitting here and agreeing with you. But I can't, because I know what government has done, and the people of this country know what it's done. So you have a difficult task of really selling this to us.
Thanks for appreciating that. Look, our current system, and I hear all the things that you're saying. Keep in mind, our current system, if you're here illegally, you get into a serious motorcycle accident and you're in a life-threatening situation, right?
Right.
You have no money, no insurance. In the end, what happens right now, based on humanitarian laws, government actually steps in and becomes responsible for taking care of the person. So in other words, the air evacuation, the air ambulance, the medical costs abroad. So in the end, we have a form of universal health insurance, right? Because if something happens to you, again, even if you just have a heart attack, right? You're undocumented, you show up at the emergency room, you have a serious medical condition, a life-threatening medical condition, the hospital's obligated to treat that person based on humanitarian grounds. And if the person needs to be air evacuated, a request is made to government, and government is obligated based on humanitarian grounds. So the hospital has a bad debt that in the end, eventually, somehow, the population has to cover, right? So we have a form of universal health insurance coverage now, but it's poorly managed.